Now, environmental health officers are kicking against government's decision to exclude them from the various incentives available to frontline health workers. The group insists that they form a vital part of the health workforce. They're also demanding that their department be provided with PPE and adequate training to handle bodies of COVID-19 victims. Here's the acting regional environmental health director of the Greater Accra region, Douglas Tego.
Everywhere in the world, the EHO is being used as a frontline health worker in curbing this pandemic and other infectious diseases. All such countries have appreciated the risks these public health practitioners go through. It is rather sad that after His Excellency, the President of the Republic of Ghana, has asked us to remain and work as those who provide environmental health and sanitation services, we were knocked off the rewarding or motivating platform based on World Health Organization burial protocols. Should a suspect or confirmed case of COVID-19 patient die at home or the health facility, it is the environmental health officers who will disinfect the premises. Meanwhile, this vital force has not been trained and equipped in relation to that. Due to the neglect of this force, COVID-19 bodies are still lying in the morgues of certain hospitals, whereas World Health Organization has stated that COVID-19 corpses should be buried not later than 72 hours. These burials must be supervised by us, the environmental health practitioners. But without special training and provision of special PPEs for the burial teams, this cannot and has not been done. Though environmental health officers have not been trained on how to handle COVID-19 bodies yet, the staff under the MOH have been trained to provide and provided with PPEs to work with. Why is our case so? Is it different? We hereby indulge the Minister of Health, to expand his list of health workers to the Minister of Finance with the environmental health officers who are considered as frontline officers as well.
Now, the group also wants to be actively involved in the supervision and distribution of relief items, especially cooked meals to the less privileged, to ensure the necessary health regulations are adhered to in order to prevent an outbreak of other diseases.
The government is doing well, and other corporate bodies are doing well by supplying food and other provisions. But we want to come in as environmental health practitioners to speak to the fact that the government needs to engage environmental health officers in the distribution of the food. But it should start right from the preparation stage. We must know where they prepare the food. We must know who is preparing the food, whether that person is qualified medically or health-wise to cook the food. Those distributing the food, from dishing right to packaging, we want all of them to be covered medically. They should be screened before they do that. So that if it is restaurants who are preparing, then they must have a coverage of medical health certificates. We don't want the fact that after COVID-19, we get people with other diseases. Swarming the population with typhoid fever and all other things that are linked to food and water is what we don't want. So we are pleading with the government that whoever is authorizing could be authorized, but then we must ensure that those people are medically screened before they distribute the cooked food and water.